Hi there, I'm Claire McDonnell Liu and this is the Family Health Lab. In today's conversation, I'm talking family health and family foods with Dr. Peter Brukner. Peter is a medical doctor and specialist sports medicine physician. He's worked with Olympic sports teams, Liverpool Football Club and the Australian cricket team. As a dedicated health expert with decades of experience, Peter believes that most of what we've been told about what to eat over the last 40 years has been wrong, and as a result we have epidemics of obesity and chronic diseases devastating families. Listen to Peter's own experiences of changing his health by ignoring diet advice and what he believes families should be eating to avoid ill health.
You're listening to the Family Health Lab. Healthy parents, healthy kids.
Hi there, Peter. Thanks for joining me today to talk about food, nutrition, health, and what you've been up to recently.
Oh, thanks for having me, Claire.
So you've just come back from your travels. You've been gallivanting around the world.
Yes. I don't know gallivanting, but I had a bit of a disaster actually because I went to speak at the low-carb Denver conference in Colorado. And I thought, well, while I'm in Colorado, I should support the local economy and do a bit of skiing. And end of day one skiing, I smashed my shoulder and broke it into 4 different pieces. And they had to give me a new shoulder the next day. So I've had a shoulder replacement. So here I am with my arm in a sling and
Gosh,
in a bit of pain. Yeah, so it was an eventful. It wasn't quite the way I'd planned my extra sort of 10 days after the conference, but anyway, it was all part of life's rich experiences and. Yeah, bloody painful. I wouldn't recommend it, for sure. But anyway, we're surviving.
Oh, that sounds awful. I hadn't realised. I knew you'd been off on your travels, but I hadn't realised that you'd have a major trauma. That's awful.
Yeah, silly me. Yeah, as my wife says, well, serves me right for being old and still trying to ski, pretend I'm young and still ski. But anyway, I'm fine.
Yeah,
fine.
well, I did hear good things about the Denver conference. I heard it was the atmosphere was amazing, really excellent talkers, and just a lot of good momentum. So that was good. It's one that I've not managed to get to yet, so it's on the wish list.
Yeah. No, it's a good conference, and you've experienced the different low carb conferences, Claire. They just tend to be good people, people are there for the right reasons. They're trying to sort of improve their own health, other people's health, and it's always a good vibe at those conferences. I think that's the most enjoyable bit about the whole thing, really.
And you learn, and I always learn something.
Absolutely,
and the topics evolve, and then you just get reminders. Talking to some people, they're just like, well, it just reminds me of how important this is. I mean, these are nutrition focused conferences, and that brings me to a comment you've made in the past, which is that most of what we've been told about food, what to eat, what's healthy, what's good for us, is wrong, and as a result, we've got the epidemics, the chronic disease, the obesity, diabetes. So a question for you then is, are we getting it right now? Is the advice that we're being given today now better? Are we on track?
Well, the official advice is probably not much better in that really the Australian Dietary Guidelines and other national guidelines haven't really caught up with the real world and the evidence, and they're still lagging behind. They're still on the sort of the low fat, let's avoid fat, let's avoid saturated fat from animals, and lots of complex carbohydrates are fine and all that sort of stuff. And as I mean, that advice, for the last 40 years, which we've all basically adhered to, we've all stopped eating fat and eat low fat this and low fat that, has been a disaster. I mean, we're the fattest and sickest we've ever been, and we're just getting fatter and sicker every year. And, you'd think at some stage someone might say, oh, hang on a minute, maybe we're doing something wrong here. And there is a small group, an ever-growing group, but a small group of people out there who have rightly come to the conclusion that it's not fat that's the problem. It's carbohydrate and processed carbohydrates in particular. and they've turned their own health around as I have and others have, and they're spreading the word. But it's still being resisted by the traditional medical establishment and the dietetics establishment. I think things are changing slowly. There are certain of the international organisations whose guidelines have sort of loosened a little bit, and who now say that it is an option or it's acceptable or something to try a restricted carbohydrate approach. So we're making slow progress, but the key one in this country, in Australia, is the Australian Dietary Guidelines, which are currently under revision. And the last time they were revised, it was quite honestly a disgrace in that they refused to even consider things like a restricted carbohydrate intake and so on. They just said, no, it's not relevant, or there's nothing new, or some pathetic excuse. And so what we're pushing pretty hard for now is that they at least examine the science. I mean, because basically we're happy to live by the science, because there's ample science out there now that shows that a restricted carbohydrate approach can be very effective in the management of not just weight loss, but chronic disease, type 2 diabetes being a classic example, and other chronic diseases. And they can't ignore the evidence. If they truly look at the broad range of evidence, the evidence is there. And so I'm hoping that the new version of the dietary guidelines, so the problem is that most doctors and other people know nothing about nutrition. So they just default to the dietary guidelines the whole time. So if the dietary guidelines are wrong, that's what's perpetuating the problem. So that's why it's so important to get that right. I must admit I don't have 100% faith in the process, but we'll keep at it. There's a very active group of people in this country, led by James Mukie and Gary Fettke and people like that, who are pushing really hard to get a seat at the table and to at least get this on the agenda.
So, yeah, and yourself pushing you three and others in that space. And I appreciate your campaigning, your advocacy, and your highlighting these issues. And we're talking about carbohydrates, which I think then families kind of get a bit confused about what's good and what's bad about the food, what our problem is with those guidelines. They're important because they shape what your children eat in school and what's available in the shops, and the advice you get from a professional, like you're saying. So that's really shapes everything. So carbohydrates is one of the factors that's a problem, and it's not that carbohydrates per se have the big issue. It's a lot of the information coming out is now how ultra processed. The processing is a factor. So they've been refined and polished and reshaped, reformed, flavored, then sold to us as a natural, healthy cereal or energy bar or snack for your children that's got pictures of fruit and added vitamin B, added fiber, etc., etc. But it's highly processed junk food. With health washing perhaps, and that's what we're eating often regularly, often daily, making us sick. And then you've talked about this topic so much over the years, the sugar in, for example, everyday breakfast cereals that families would be eating basically amounts to dessert, giving your child something you wouldn't give to your pet, because it's so harmful. And we've been really steered down the wrong route with our food. So those guidelines, as you said, that are under review at the moment. We're about 2 years into a 4-year process. The process slightly delayed, and we, a group, are putting together a large compilation of evidence and asking for this evidence to be looked at, and that's around saturated fats, ultra processed foods. The carbohydration, the amounts of carbohydration, that's not a word, is it? The amounts of carbohydrates, it should be, maybe, carbohydrates that we're eating, and then the fact that these are the guidelines that are being given to people with weight problems or diabetes or chronic disease, and they're not suitable for those. They need a different type of guidance around perhaps carbohydrate restriction being one of their option. This all brings me to your own experiment a number of years ago. I'm not sure how many years ago. You did a 3-month experiment on your own health. Can you tell me about that?
Yeah, sure. It's actually 10 plus years ago now. Yeah. I was 60, living in Liverpool, actually, in England, working in the at the football club there. And if you'd asked me then, how was I? What was my health like? I'd have said, yeah, I'm fine, I'm good. I was eating a so-called healthy diet. I was exercising, so on. The reality was I wasn't nearly as healthy as I might have thought I was. I mean, for a start, I had a family history of type 2 diabetes. So my father had developed type 2 diabetes exactly that age. I was quite overweight, probably borderline obese, like many sort of middle-aged men, and I consider 60 middle-aged. I used to think it was old, but now it's middle-aged. I'd probably put on, sort of half a kilogram a year for 30 years, and just slowly getting thicker around the waist. My kids are sort of poking me in the guts and saying, come on, Dad. And I'd shrug my shoulders and say, well, I'm on a low-fat diet. Anyway. And I had some significant metabolic issues. I'd had a fatty liver for 10 years. Like a typical doctor, I ignored it. I didn't really understand what a fatty liver was. I was just a sports medicine doctor, really. I didn't understand that sort of stuff. And so I'd had that for 10 years, done nothing. Figured I was on a low-fat diet. That was probably the right thing to do. I had no idea. I had high triglycerides, high insulin levels, and so on. So I was metabolically unwell, and clearly in retrospect I was pre-diabetic. I mean, I have no doubt that had I stayed the way I was going, I'd have been type 2 diabetic within a matter of time. So around that time, Tim Noakes, who you and many others would know of as one of the leaders in the sort of the low carb movement. Tim is an old friend of mine. We go back a long way in the sports medicine, sports science world. And he started to talk about the fact that he thought we had it all wrong, that it wasn't fat that was the problem, it was carbohydrate. And I must admit, my first inclination was, "Come on, Tim, you've lost it this time, mate. You've been right on a few things in the past, but don't be ridiculous. We can't all have been on the wrong diet for 40 years, But because I admire Tim's brain very much, and he'd been right a few times before in issues of sports science that he'd challenged. I thought, no, I need to look into this. So I started reading. I read Gary Taubes's book, Good Calories, Bad Calories, and that book just blew me away. I mean, because not only did it talk about the relative merits of fats and carbs, but talked about the politics of how the low-fat movement had won out over the low-carb movement, which I'd always assumed was due to, good science and evidence. And turns out, like most things to be due to money, power, and politics, really. And I remember, I was really disturbed reading this book. I mean, I remember sitting on the edge of my bed one night in Liverpool, looking out over the Mersey River there. It was a lovely spot, thinking, this can't be right. Like, we couldn't have, something as basic as this. The whole of Western society has been on this diet for 40 years. And here's the evidence showing that it's a load of rubbish. And yet, you could see, well, clearly, we've just got fatter and sicker in that 40 years that, we're doing something wrong. And found it very challenging, very disturbing. So I dived into everything. I'm a bit, OCD. And so I dived into everything I get my hands on and read and so on, books and articles and so on. And then decided it was time to try it out myself. So I decided I'd do a 3-month little experiment on myself. Day one, got all my bloods done and weight and everything. And then went on a low-carb, sort of healthy, fat-healthy protein diet. So no sugar, no fruit juice, no cereal, no rice, pasta, potato, all that sort of stuff. Went back to eating the way that probably my grandparents had eaten. Just good, real food, meat, fish, eggs, eggs, all that cholesterol, dairy, full-fat dairy, cream, butter, oh, my God, butter, vegetables, non-starchy vegetables, and the only fruit I had was berries. So decided I'd do that for 3 months. So, I won't bore you with all the details, but to cut a long story short, at the end of that 3 months, I'd lost 13 kilograms in 13 weeks, despite never being hungry, eating as much as I wanted to eat. Hunger was the first thing I noticed. I mean, I stopped being hungry. Normally if I have my cereal at, 8 o'clock in the morning and, you get to 10:30 and think, oh, God, is it lunchtime yet? And whereas I'd have, bacon and eggs and avocado or whatever for breakfast, and I wouldn't eat again all day. So I went from eating 3 meals and 3 snacks a day to eating 2 meals a day, which I still do now. Anyway, so I lost all that weight. I sort of felt guilty, or sort of embarrassed, really. Like I thought, losing weight's supposed to be really hard, and yet I just found it so easy, that I'd eaten all these lovely foods, and lost weight. It was just bizarre. And then I did my bloods, and everything had gone back to normal. So fatty liver, triglycerides, insulin levels, all absolutely normal.
Wow.
And as I said, I'd had a fatty liver for 10 years. Within 3 months.
Goodness, 10 years.
Could have been less. I mean,
yeah.
I only did the blood test after 3 months. It might have been 3 weeks. I don't know. But it was certainly, at the end of that 3 months, absolutely normal. And it just blew me away. I mean, I couldn't believe, the effect it had. And I guess, as a result of that, I've become a sort of a passionate advocate of that way of eating, and got more involved in the whole sort of area, read a lot, started giving talks. We started a charity called Sugar by Half, which with the aim of cutting back added sugar by a half in Australia, because the average Australian probably has about 18 teaspoons of added sugar a day, and the World Health Organization recommends no more than 6. So we're well short of that. So we've been running this campaign for a while now. We're focused on schools. We have a lot of school lessons that are available for teachers to present on sugar and sugar-related issues and so on. And then I wrote a book. I got approached to write a book, and my initial response was, well, the last thing the world needs is another bloody diet book. But they convinced me that there were not many by Australians, and particularly Australian doctors. And so I wrote a book called The Fat Lot of Good, which has been a bestseller. Continues to sell. It amazes me, really. But that sold really well. And then a couple of years ago, I guess type 2 diabetes is always the sort of the elephant in the room as far as this goes. And I'd seen some really good results from online programs and apps overseas. So myself and Paul Mason and Nicole Moore got together, and we put together initially an app-based program, now a web-based program as well, called Defeat Diabetes, which launched a couple of years ago. It's a subscription model. It's gone pretty well. We've had over 8,000 people take up the subscription, and we're doing a formal study through La Trobe University to assess the efficacy of the program. But our initial survey showed, similar to the international results, that 50 to 60% of people on this program put their type 2 diabetes into remission. Now, you've got to remember that that's not supposed to be possible.
We've been reading, and you highlight this in many of your talks, that they've been saying that this is a progressive disease, non-reversible, meaning that and stating in literature, in the health bodies, that diabetes, different associations around the world saying that you will need a lifetime of medication. So to get 50 to 60% through an online remote program, and then reverse their symptoms, and balance their blood sugars, and be no longer diabetic, that's an incredible achievement. And it can be possible. You can do that alone, without support, and people are doing it thanks to the information. For example, you're putting out there Low Carb Down Under, etc. Your resource, but a lot of people do need support. They do need to access, and for around 8,000 people to get support that otherwise wouldn't be available to them in Australia is pretty outstanding. I think that's excellent. I'm looking forward to hearing more of the research and the kind of information that comes from that. But it's wonderful. When you went through your own life-changing experience and had those phenomenal results, which I've worked with people with diabetes. I've worked in the NHS with groups. And I've got, one example was working with somebody called Harish, and he was diabetic for 12 years, and he tried everything to sort out his diabetes. He'd gone to a retreat in India. He'd gone to a different practices. One person told him to eat pineapple every day, and he did it diligently. But so he tried, and he bought books, and he tried. And when this was given to him as an opportunity, and I was supporting a group of, say, 20 people, within 3 months he was off 2 medications, and then the third one for his statins, he came off those eventually as well. It was he was delighted, and it's about giving people that opportunity. And you touched on your book. that lot of good. And you were saying, does the world need another book? And you're surprised how well it's selling. It's a phenomenal book. I use that in those groups that I've mentioned. I've worked with groups in the UK, in medical practices, and online groups here in Australia. And it's something that I go back to again and again. The resources in that book are just so, it's in layman's terms. It's the traffic light systems, telling people what food, and not telling them as in a prescription. You're not kind of laying down the law. There's so much flexibility and common sense and good practical resources. But the traffic light system of what foods they could eat, mostly of the green and then the amber orange ones, they have less of, and then try to avoid the ones in red. It just really helps people with that straightforward common sense information, and it just all of that is written so well, and explaining how to eat out and just so many different aspects of that great resource. So since your own experience 10 years ago, around 10 years, with your amazing health results and your additional results, more energy and better sleep and all of that, you didn't have to kind of go into campaigning and advocacy. So I'm wondering what made you choose the second choice of, was it that personal experience for yourself? Your father was also had diabetes, and I don't know what his experience was like, but something must keep you fired up.
Yeah. Look, he suffered as a result of his type 2 diabetes and so on. Certainly, look, I think, when you have an experience like that, you've got one or two choices. You can either sort of say, all right, I'm all right, mate, I'll look after myself and fine. But, I just felt that, I'd stumbled across something. I'm certainly not going to pretend I discovered it. There are lots of smarter people than me were onto this a long time before me. But, I'd come across it, and I sort of felt I wanted to give people the opportunity to have the experience that I'd had, and get the benefits that I'd had. So I really felt some sort of moral obligation, I guess. It sounds a bit noble, doesn't it? But just to get it out there and to tell people about it. And besides, people would come up to me the whole time and say, "Oh, what have you done? You look so different. You look so well. All that sort of stuff." So, and I guess I was probably at the stage of my career, in my sports medicine career. I'd been doing it for 30, 40 years. I'd had a fantastic career. I'd achieved everything I'd ever sort of dreamed of doing. And I guess, I sort of saw this as an opportunity for the sort of final stage of my working life, I guess, to make a difference, to have an impact, to benefit people, I spent my life fixing up ankles and knees and hamstrings and so on, which is great, and so on. But, this was actually having an impact on people's longevity, on their quality of life, on their quantity of life. And it was something that I guess I kept waiting for someone else, for other people to sort of advocate it and so on. And nothing seemed to be happening. And I thought, well, stuff it. I'll just have a crack myself and see if I can make a difference. And that's what I'm trying to do. We've had 8,000 people do the program. I want to have 800,000 people do the program, because the impact on their health and the health of our whole society will be enormous. So that's the frustrating thing, is you just wish that, more people would be aware of it, and you just got to chip away. And I go out and give, a couple of talks every week to some, groups, some of them as small as 10, some of them as large as 1,000. You just got to try and get the message across.
Yeah, and the 8,000 that have gone through. I mean, it's a good number for a young program. This is Defeat Diabetes. It's an app and a web-based platform. And there's a phenomenal amount of support available to people. It's resources, recipes, but there's coaching involved, isn't there? And they can get advice. There's a great sort of Facebook group of all the subscribers that is very active, and people are always sort of posting suggestions and advice and so on. But it just gives you all the sort of both video and written word about just the background, about practical information about. So part of it is why and how and lots of as you said, recipes, meal plans, cooking demonstrations. There's pretty much everything you need to tackle type 2 diabetes. And as I said, the results have been terrific, and the feedback has been great. So that's very rewarding, because
it's like, Claire, you get a bit frustrated sometimes. You feel as though you're bashing your head against a brick wall, and you're up against all these sort of powerful, enemy. Well, I won't call it enemies, but people who are resistant to change, and you think it's so obvious that the dietary guidelines should be changed, and yet it just why is it so hard? And why is the medical profession and the dietetics profession sort of dragging their feet? When the evidence is overwhelming that that the low carbohydrate approach is right. So you do get frustrated, and you think, oh God, I'm never going to get anywhere. And then, every day or two you get an email from someone saying, oh, I've had these fantastic results and you've changed my life. And, you think, oh, okay, all right, we'll keep going for another week.
Well, do keep going.
Yeah,
I mean,
you do get,
I guess,
you do get.
I think people have just, we as a society, we've become complacent. Diabetes is just, it's kind of often, we downplay it, I suppose, until you have it yourself, or somebody is experiencing complications. And this, I think, I don't know, just to emphasize how horrible it is, the complications, it's the leading cause of blindness, kidney disease, stroke, dementia. These are the conditions that are headlines. We've got such a sensible approach to tackling this, and defeat diabetes is, that's what people need. They need support. Some people, very few, are, a percentage are early adopters, or they can make changes independently. But a lot of us need support to undo food habits, food changes, understand things, deal with the challenges, get motivated. We need our tribe. That's what you were saying earlier about attending some of these low carb conferences. They bore you up in the way that you're at will. And now you're bringing out a book. I'm afraid I don't have my copy yet, but I'm looking forward to getting that. And I'd like to hopefully put a piece out with Low Carb Down Under on that. Can you tell me about?
Yeah, I've got it here, I think. Just a minute. Where are we?
I'd love
Here
to.
we are.
Yeah. And I'm looking forward to getting my hands on this. And it's a resource. I did look at some of the recipes, and they look delicious, really, really tasty.
Yeah, look, it's just it's an extension of the previous book, just focused mainly, pretty much entirely on diabetes, and it complements the app and the web-based program, the Defeat Diabetes program. But it's it's in very simple language, very easy to understand, and lots of very practical sort of information. And it came out last week. It hit number 2 on the Amazon best-selling list last week at one stage. So so it's obviously, I mean, as you said, it's just such a common condition. I mean, I think it's, I don't want to, be melodramatic, but I think it's the number 1 health problem in our country. I mean, there are 2 million Australians with type 2 diabetes, and another 2 million with pre-diabetes. And, what I don't understand is why people don't seem, to be jumping up and down about it. We put the whole country to a halt for an epidemic, recently. And I would argue that type 2 diabetes is more of a problem, and yet we totally ignore it. And I think one of the reasons you alluded to, I think one of the reasons is that people don't die of type 2 diabetes, but it's all those complications that you mentioned: the blindness, the amputations, the heart disease, the Alzheimer's, the kidney disease. I mean, they're the big chronic problems in our society, and type 2 diabetes is the biggest single risk factor for all of those conditions. And similarly with COVID, I mean, type 2 diabetes was a major risk factor for a poor outcome. So why don't we tackle, the type 2 diabetes side of things, to get, prepare for the next pandemic or whatever. So, it's not sexy for some reason, type 2 diabetes, yet it's debilitating, and, it's just a massive problem in our society. And if we can get on top of that, we can take a huge, I think it's the biggest single thing we can do to improve our health, is to tackle the type 2 diabetes situation. And clearly the way to do that is by restricting carbohydrate intake. I mean, it's very simple. Type 2 diabetes is a disease of carbohydrate intolerance. And if you're intolerant to something, don't bloody eat it. It's so obvious and simple, but we've just been sidetracked by this obsession about fat and, heart disease and all this sort of stuff, which is all a load of rubbish. So I just think we need to focus on getting our diet right will reduce the type 2 diabetes, will have a huge impact on all those chronic diseases. And it's the biggest single thing we can do for our health.
Diabetes is one end of the spectrum, and then you're tackling this on the prevention end with Sugar by Half. The royalties from your first book, that goes into funding those resources for the schools so that teachers have got the right information. That's really reassuring for me, because a lot of the health information still being taught in schools is outdated. So a family contacted me the other day. Often you get approached by people, and I get questions from families, and they were saying my child has been red flag as overweight, and that they're bringing us in and offering us this nutrition advice, which is low fat for this child, and eat more, move more, and this type of thing. And they were saying, where are the trusted resources? Where can I go? And this is an active family. That child has nutrient dense foods. He doesn't look overweight. He's probably got a very dense bone structure as well with the healthy foods he's been eating. But what I'm alluding to is the confusion out there. And as a grandfather, what advice would you give to families? Like, how can they head off getting into this trouble in the first place?
The easiest way to stop people, getting addicted to sort of sugar is to not start them. I think, and look, I'll put my hand up. When I was a parent, we would, you'd breastfeed, wife breastfeed the kids, and then you'd start them on things like apple juice and orange juice and full of lots of sort of sugary stuff and so on. So you just got to, right from day one, keep sugar out of the equation. And not completely, but by and large, stick to healthy real foods. And the problem is, that it's just all processed foods basically have added sugar, and we tend to take the easy option, and we get a packet of yogurt you can squeeze, with fruit yogurt full of sugar and things like that, and it's just easy. And it's, go to the supermarket, you grab one, you give it to little Johnny, and, it shuts him up for a while, and, away we go. But, I think it's really important to invest in your kids' food, and get them used to fresh food and full fat dairy and, plenty of good healthy fruit and vegetables and meat and fish and eggs and so on. So right from the start. And, a sugar treat can be a treat. You go to a birthday party or something. I'm not saying, you can't have anything and so on, but, it should be a treat rather than what it is now is everyday food. And, the sort of things that we used to have as treats, way back then, while we're having a birthday party, this month, I'll get to have a lolly or something like that, Nowadays, it's just, as you said, every breakfast is like dessert, and full of sugar. So I think it's really important, because once you've started them on that sort of sugar habit, it's really hard to kick it. And if you don't start them, get them drinking water or milk. They don't need to drink fruit juices or fruit drinks or soft drinks or because they're full of sugar. And again, we were wrong. We thought that fruit juice was healthy, and it turns out that it's got as much sugar per mil as Coca-Cola does, and so on. So we just, we just have to learn from our generation's mistakes. And, you've only got to look at the incidence of childhood obesity and overweight. When I was growing up, you never saw an overweight kid, just didn't see them, and nowadays, almost a third of Australian children are overweight. It's just,
it's frightening.
There's got to be a reason for that. We haven't stopped moving. Kids still move. So it's not lack of activity. It's what we're putting in our diet, and that, since we adopted the low fat, high sugar diet, it's been a disaster, and we've just got fatter and sicker. And the sooner we wake up to that, the better.
Absolutely. Those statistics you're saying about children being overweight and how we're still giving people the same messages we've been giving for 20, 30, 40 years. And we're now talking about genetics. It must be a genetic issue, which is just ludicrous that our genetics en masse have changed. It's almost like we've just
one generation
keep putting the blinkers on, and it was.
Yeah, exactly.
And it was interesting your comment about why we're letting this kind of go past us. And I suppose we're a busy society, but also your comment earlier about your own health. I think we've become as a society to think that putting on this weight around the middle, around visceral fats, and then starting to get complications or health symptoms that make us feel a bit foggy or sluggish, and then eventually like a health marker starts to kind of give us a red flag, then another, and then we've got a diagnosis. I think we've come to think of this as the way we age as a society, and we definitely think about the body image now as these are becoming the normal body image, and all of that. But with type 2 diabetes becoming pervasive in the population, I mean it's a significant number, but that is a significant proportion of our population. But now young people are becoming diagnosed with diabetes, and that's set to quadruple by 2050, which is grim and shocking. It should shock people, and it boils back down to what you're trying to support us and put resources and give information. That there's a really simple prevention strategy with sugar by half, reducing those sugars, and there's a really fairly simple way to reverse that and get out of that and get off those medications once you've gone down that route. So just in terms of the finalising, have you got, as well as your resources that I will put links to, and I would advocate people get those in front of their loved ones and look at those recipes, even if you've not got diabetes, or I think get those resources for sugar by half in front of your school and your community and your sports club as well. But is there anything, another tip or piece of advice you'd like to leave people with?
Well, I always say if there's one piece of advice that you take from any of my talks and books and so on, it's just called JERF, JERF, just eat real food. If you do that, you're not going to go far wrong.
That's my absolute favourite nutrition policy, a piece of advice and to live by. We don't even have to complicate things. Back to real food and real cooking. Simple. I love that. Thank you, Peter. Thank you very much for your time as well.
No, pleasure. Thanks for having me, Claire.
Thank you for watching. If you like this video, please make sure to subscribe. This really helps us to be able to create more content.